And then for Michael, just by palpating, his TFL is actually a little bit tighter than his piriformis. This side. Hey everyone, this is Dr. Jonathan at Kalkstein Chiropractic, your Baltimore area chiropractor. Today, we're going to go over the case of gluteal tendinopathy. So, we have our subject here today is Michael. He graciously volunteered for this, and then also we're going to have Sabrina helping us with some movements in here. So, first, let's talk about what is gluteal tendinopathy. Gluteal tendinopathy, or even glute tendinitis, depending on the part of when it starts. So if it's really acute or very early on in the treatment, then we're going to call it tendinitis. If it's prolonged for maybe like 2 to 3 months and it's still there, then I'm going to call it tendinosis. Tendinopathy is the umbrella of the two terms. So what that is, basically, there's your glute muscles, glute max, glute med, and glute minimus. It starts from superior, more superficial, down to a little bit more deeper. So the two tendons that really correlate with the tendinopathies is going to be your intermediate and your deepest one. So your med and your minimus. Those tendons, so they first attach to your iliac crest, and then they attach to what we call your greater trochanter. So you can kind of do that yourself, where your hands by your side, kind of turn your foot in and out, and then you feel like a bone pop into your hand. That is your greater trochanter. Those two tendons attach to that area and are easily compressed. When it's compressed, people complain of very pinpointed pain in this location. People who get this, primarily, runners are a very common one just because of the frequency that they do, so long distance running. Other people that sit for work, sedentary jobs, and the kind of population that we work with are mainly women, 4-to-1 ratio, with age groups primarily 40 and up. Now that doesn't necessarily mean that you have to be 40 years old or a woman to have this, so men and younger people also get it. So how we test that is, first, patient comes in with complaint of pinpointed hip pain right about here, and then there's a few tests that we could do on the table. Since Michael is here, I'm going to ask Michael to raise this leg up straight, and then I'm going to ask him to resist me. So don't let me push down. I'm going to push, and Michael's strong, and Michael doesn't have tendinopathy. He's just a little subject for today. But if he did have it and I push down, pretty immediate that's going to give out because it's weak and painful. The other test that is really specific, meaning it's going to roll it in if it's positive. So once you stand up for me, please come to this wall, and then let's say it's his right hip that he complains. So I'm going to ask you to kind of stand like you are, your left index finger on the wall, for just a little balance purpose, and then stand on your right leg with your left heel lifting off the floor. Most of the weight is going to be on that right leg, and generally within about a minute, the patient, if it is a true tendinopathy, they're going to be like, yeah doc, that hurts, that's tender, or they get weak and then they kind of collapse in there. That's a really good, also Trendelenburg is another test where that glute med is weak and it kind of dips down. So Michael is strong, like I said, so let's just pretend, is that painful?
A little bit.
Yeah, so, and where is that painful?
Right in here.
Right there, and that's where they would point to, right there. If it's like low back, then it might be like a referred pain, and you can take a rest with that, and then lay it back onto the table. Keep in mind, a lot of the correlated tissues with the hip and the low back are so closely related that 35% of people with gluteal tendinopathies will also have low back pain too. So that is the presentation, the etiology, and now how do we treat this. So there's a few modalities in-house that we can use. One of them, as most of you know or have heard, is called dry needling. You using acupuncture needles into the affected area. So for those that don't really know the difference between acupuncture and dry needles, acupuncture focuses on more pathways to affect our chi or energy, and then they might put them like in his ankle or wrist and then affect somewhere else generally. For dry needles, we focus on trigger point therapy, so it's really affected into the region that we're really working with. So dry needles, another option would be ART, active release technique. So this is where I'm going to have Sabrina come in, and we're going to demonstrate how we would focus on stretching these muscles out. So first one is going to be the piriformis. Most of you guys know piriformis from piriformis or sciatica. So what we're going to do, I'm going to pin this muscle with my hands. Michael's going to relax his leg as best as possible while Sabrina moves his leg into space. Perfect right there. And then gradually go into external rotation. So it's a little uncomfortable. It's a love-hate relationship.
It hurts so good.
It hurts so good, as Michael says. So we do a few passes, and we're really trying to pin the origin of the muscle right here while stretching the elongated tissues too at the same time. And once we do a few passes, Michael's going to get up and be like, you know, Doc, that feels pretty good, but very short-lived. So that's why there's a lot of different modalities that we do offer. So that was for piriformis. Next, we're going to do TFL. TFL is just a name for tensor fascia latae. So, not the right poster, but if you can imagine, your IT band is a big band of fascia, and the muscle TFL is right above that and connects to the TFL or to the IT band. So, same concept. I'm going to find the belly of the muscle, and Sabrina's going to move the leg. Beautiful abduction. Keep going. Hip extension. Keep going, keep going. And then, yep, extend the knee and drop the leg. And then for Michael, just by palpating, his TFL is actually a little bit tighter than his piriformis. And you probably can vouch for that.
Oh yes.
So we're going to do one more pass. Back up. And then full extension while dropping the leg and knee. Good job. So that is what we call active release technique. And we would do that in conjunction with the needles, probably some heat and stim, and then of course adjustments to the areas that I would want to affect. So that was the modalities, or ART, active release technique, for the muscle that we're working with. Adjustments will help stack with that. But then a few things that the patient can do to help prevent the compression of these tendons. So if you are someone that sits down in a chair and crosses their leg like this, if Michael was his right hip, this would be putting the leg into adduction, crossing the body midline. When you do that, that compresses the tendons even further. In addition to that, if you also, someone that stands and favors one side on your leg, that is also going to put more pressure on those tendons too. So if you do that and you have pain in that hip, you might have either bursitis or tendinopathy. Try to eliminate or kind of be conscious of those positions, and then later we'll go over what we can do for rehab. But now we're going to adjust Michael, and we'll get started with that. So since you're in position here, we will get started on this side and here. Tighten it down.
I know. Working on it.
It's okay, let's get these hips all loose. So for golf, this is my golf teammate, by the way. We play weekly, we're crushing it. We're gonna join the tour. So I'm gonna drag this down, hold this here. You can feel a little compression. Big breath. Easy exhale. Good. Already cracked before I even thrust it. So, on your back now, please. And usually I would only probably adjust one or both sides, but Michael, I'm just going to adjust that side and then do a little long axis distraction for his hips. So you can feel a tug, Michael, just like that. Same thing, we'll do this side. Nice, that was even better. So that is part of gluteal tendinopathy and just a sneak peek of how we treat that in the office. If you would like to see more videos of how we treat these or just have general comments, just type them below. Thanks for watching and we'll see you next time.